Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you today with our weekly podcast. As I was drinking my coffee this morning out of my old coffee mug, which I love because my office staff gave it to me. It's really thick, it's large, and it says doctor on it. I love that. I was reading about the great effects of coffee, so I started reading this new study which said that 3 cups of coffee per day, caffeinated coffee, protects your liver. It actually decreases the stiffness of your liver. In this study, though, I noted that 74% of the people in the study were overweight. I wondered why. Well, it turns out it's because 74% of people in America are overweight, so that's average. As a matter of fact, 42% of Americans are obese. That means a BMI of over 30. The healthiest countries in the world are Japan, Switzerland, Spain, and Italy. So I started thinking about that, and those are countries that are not having the problem with COVID that we are. So let's talk about obesity being the major risk factor for getting sick with COVID. There's no doubt about that. Even being overweight causes it. In a journal called Obesity Reviews, studies took 400,000 Americans, and it turned out that if you're obese, you're 113% more likely to be hospitalized with COVID, 74% more likely to go in the ICU, and 48% more likely to die. Now, those with a BMI over 40, which is morbidly obese, 92% higher risk of dying. Now, it's even worse in young people. The young people that are at risk for this are usually morbidly obese or have another coexisting comorbidity. Why is that? Well, it turns out the obese have impaired immunity. The fat cells infiltrate the organs where your immune cells are produced and stored, like your spleen, your bone marrow, and your thymus. Turns out the fat replaces immune tissue. Plus, the immune cells are less effective. Your T cells don't function as well in obese people. And also, the memory T cells are decreased so that future attacks of COVID and other viruses are more likely. I'll give you an example. If you're vaccinated with a flu vaccine and obese, you're twice as likely to get the flu as vaccinated people who are not obese. Another reason obese have more problem, they have more inflammation. Fat cells secrete cytokines, which are messengers that increase inflammation. They also bring in macrophages that come in and try to clean out the fat cells. The obese people are more likely to clot their blood more easily. And that's what eventually kills COVID patients is blood clots to your lungs. The WHO reported that 2.2 million of the 2.5 million COVID deaths worldwide occurred in countries where half the population was overweight. So this turns out to regulate that COVID deaths are 10 times higher in these countries than obese people. Look at Vietnam, a country with one of the lowest death rates from COVID. Only 18% of their people are overweight. Even the CDC study that came out said that 78% of hospitalized patients on a vent and that are dying were overweight. And remember, a man that is 5'10" and weighs 175 pounds is classified as overweight. A woman that's 5'4" and weighs 146 pounds is overweight. So that's remarkable to me. So these people are dying, they're getting COVID, they're dying more frequently from COVID, and it's just really significant. The other factor I want you to realize when we start talking about this is the cultural effects of COVID. You know, it's COVID is killing a lot more blacks, Hispanics, Native Americans because there's more obesity in that demographic. There's also, brings up another point, a lot lower vitamin D levels in that demographic. For sure, because if you're darker skinned, you're not going to absorb your vitamin D as well. It may be one reason why women die less of COVID than men, because they're taking vitamin D for prevention of osteoporosis. So there's a lot of factors that go into this thing. The two main things you need to remember that taking vitamin D is going to reduce your risk factors for getting and dying of COVID. And remember, take D with K. Vitamin K with anybody over 40 is mandatory if you're taking D. So, I mean, even Dr. Fauci says he takes vitamin D. It's cheap, it's safe, it works. I like to see your levels from 60 to 80 or even 100. But anyway, we really need to focus on this. Taking vitamin D is a simple solution, but obesity is more complex. There's a lot of complexities to your metabolism, hormones, etc. So obesity is a complex problem. It has nothing to do with laziness. It's a metabolic disease that needs to be evaluated and treated. Which is one of the main reasons I started performance medicine. I noticed I was using too many medications on people, not getting to the root cause of the problem, which is they were obese. And we're only talking about COVID here. What about all the other things that obesity causes, like diabetes, heart disease, cancer, sleep apnea, sudden death, arthritis, depression? I've kind of circled back to the main reason I formed performance medicine, to get people normal weight. So this is very important. So take vitamin D. If you're obese, even a mild reduction in your weight has tremendous effects. I'd like you to get to a normal weight. So come and see us at Performance Medicine. We'll look at your metabolism. We'll check your vitamin D levels. We'll look at your inflammatory markers. And if you're looking at this podcast, we're going to treat your COVID when you get COVID, if you get it. Hopefully you'll have a mild case, but it's important to treat it early. Early intervention certainly helps prevent you from having to go to the hospital with COVID-19. We've treated so many cases over the last year and a half. It's unbelievable, with good success. So this is Dr. Tom Rogers coming at you today at Performance Medicine. I'll see you next week.